Good evening and welcome to Cafdil Healthcare. We are live on Facebook, Cafdil Cape Coast, and also live on YouTube, Cafdil EDU. Tonight, we are discussing HPV vaccine campaign. This campaign is very necessary because the whole of this month is the vaccination campaign. And so it is very important that we let you know exactly what's going to happen so that you avail yourself for this campaign. My name is Kojo Arthur. I've been joined here by Thelma Adams Abraham. She is a public health nurse at Cape Coast Teaching Hospital, and Efua Sechua Asan, also a public health nurse, Cape Coast Teaching Hospital. Victoria Layton Century, also a senior nursing officer from Cape Coast Teaching Hospital. I'll go for this short break. When we come back, we'll start talking. Stay tuned.
Since time immemorial, God has always communicated himself and his will through various voices. The prophets, the kings, the judges, not forgetting John the Baptist, who was a precursor to Jesus Christ and gave us the will of God. We bring to you Voices from the Valley. This is a program designed by the Conventual Franciscan Friars in Ghana in collaboration with Cafdil TV to bring you in-depth insight in our faith, catechesis, and various Catholic teachings which will help you in your journey as a pilgrim. I know you cannot miss this program, and I highly encourage you that you shouldn't miss this program because it is Voices of God from the valley of prayer and silence. Join us this and every Sunday at 3 p.m. and a repeat on Wednesday at 7:30 p.m. here on Cafdil TV and on our various social media platforms, YouTube, Cafdil EDU, and Facebook, Cafdil Cape Coast. Let us meet and share what God has for us through the Voices from the Valley.
Lord, make me a means of your peace.
Welcome back. If you just join us, this is Cafdil Healthcare on Cafdil Television. Tonight, like I said, we are discussing HPV vaccination campaign, which is going to be enrolled, within the whole of this month, actually. And so we're going to let you know exactly, because most of us are afraid of getting these vaccines, and so we have to calm your nerves. We're going to dive into it for you to know that there's no, it's not all that serious. You have to take all those fears out. Ladies, you are welcome.
Thank you.
Hope you are doing well.
Yes.
Okay, so like I said, HPV. I will start from you. Your name Vic, right?
Yeah.
So you tell us the HPV, what is it and how is it transmitted?
Okay. So the HPV stands for human papilloma virus. Yes, it's a virus that causes most of these sexually transmitted infection, and it is passed on from persons to persons and skin to skin contacts. So that is how it actually is transmitted. Yes.
So how is it transmitted? How is it?
Mainly through sexual intercourse.
So it's sexually transmitted disease?
Yes, it is
one of
the causes of most of the sexually transmitted disease. The HPV is actually found on the skin. So having a skin-to-skin contact with persons or having a sexual intercourse with someone who has the HPV can actually be transmitted to you.
Yeah. So you have a sexual intercourse without protection?
Without protection. Even with protection, a skin to skin
So the virus can be on your skin,
Yes.
just your skin?
Yes.
Oh, okay. I thought it's found somewhere.
No. And what actually makes it alarming is that it can actually stay with you for close to 10 to 20 years before you see manifestations.
Whether you are asymptomatic or not.
That is why it's called the one of the diseases, that is the cervical cancer that the HPV causes, is called the silent killer, because you have the HPV with you, you would not show any signs and symptoms of having cervical cancer or any of the cancers. By the time you start seeing these signs and symptoms, it means the virus has actually turned into cancer.
Hey, then it's very dangerous.
Yes.
If what? How common is HPV and who is most at risk?
Okay, HPV is very common in Ghana here and worldwide. When you talk about it, HPV viruses, 4 out of 5 women normally test positive to HPV, or they have the viruses. So this makes it more common in Ghana here, and the people who are mostly affected are both the males and the females, but the females are much affected than the males. Yes.
Why?
Because of their nature of the reproductive system. The females have a larger surface of the reproductive system, unlike the males. Yes. So we, the females, actually get contacted with the virus more than the males do.
Male also. So when you take 5 males, like female, you said 4 out of 5.
Yes.
What is the rate for male as well?
For the males too, when you take for the males, it's 1 out of 5.
1 out of 5
for the males,
and 4 out of 5. So we don't get it like that.
Yes.
Thelma, so what type of cancers or health problems, can HPV cause?
Okay, so with HPV, it causes different types of cancers. It causes cervical cancer, throat cancer, skin cancer, penile cancer as well. So all these cancers.
What is penile cancer?
It affects the penis.
Oh, okay.
Cancer which affects the penis. Even though it's not common, it is there.
Which means we have to find a day and talk about it, because we always talk about cervical cancer. But which means if we have this kind of penile whatever cancer, then it's very important that we find a day to talk about. I've not heard it before.
Even anal cancers.
Anal cancer as well. Yes.
Hey, then I don't know him too.
Very dangerous.
Okay, so.
Yes, so our focus now is cervical cancer because of the campaign that is coming up. But as you said, we'll talk about the others if the opportunity brings itself.
All right, so cervical cancer affect what? What is the cervical cancer? Brief on that.
Okay, so cervical cancer affects the cervix, the mouth of the uterus. That is where it affects. Unfortunately for us women, you don't get to see your cervix to identify whether you have it or not, unless you are attended to by a health professional, a qualified health professional. So that makes it even more dangerous, because you can be there, because you don't have access to your cervix, it's inward. You wouldn't tell if you don't go for screening. So that is it.
So apart from these cancers, what other health problems can this HPV cause?
Okay, so HPV, as I said, with the cancers, if not treated, it can bring other things. For example, development of warts, genital warts. It's a growth that appears on the genitals. Apart from the genitals, it can appear in other parts of the body. So if you are protected from HPV, all these warts, you are also protected from them. And then, as you know, if you develop one condition and you are not treated, it brings about others as well. Not necessarily HPV preventive conditions, but other conditions which could have been prevented if you had sought treatment first.
So Vic, how does the HPV vaccine that you are enrolling this month work to prevent these diseases?
Okay, so as we've been talking about, the HPV is mainly through sexual contact, and research has shown that ladies or young girls between the ages of 9 to 14 in Ghana, probably they might not have started any sexual activities. So when they get the vaccine before that stage of their lives, they are covered. So once you get vaccinated before you start any sexual activities, you know that you have an immunity to that. So you are vaccinated. Now maybe at the age of 15, 16 upwards, you start your sexual intercourse or a sexual affair with other people. You are vaccinated.
But have you done survey in Ghana to know that nowadays 9 to 14 that you are talking about, they are not engaged in any sexual activity?
Okay.
Because some are 11 years, 10 years, they have boyfriend. In fact, some have gone all the way to do family planning and stuff.
Yes, that is true. But the research that has been done now, normally young girls between the ages of 9 to 14 years is the age category that we are concentrating on now, because the research showed that before they begin all those activities, they would fall within that age range.
So the vaccine will prevent those HPV?
Yes.
Okay.
Yeah.
So what about if the person within that age bracket has already involved in this activity?
So
is it still going to protect her?
So getting the vaccine alone is not enough. Even after getting vaccinated, from time to time you need to be screened. So you get a vaccine, fine. Probably you've already been engaged in sexual activities that might have gotten you exposed to the virus and all that. But from time to time you'll be screened, and you could pick up any precancerous lesions. Yeah.
Let's see different types of HPV vaccines available today. What are they?
Okay, for now, Ghana, we are using the Gardasil 9.
Gardasil 9?
Yes. Gardasil 4, sorry.
Gardasil 4?
Yes.
Okay.
So that is what we will be using for the vaccination in this month of September. So we have different types as well, but we are using the Gardasil for now to protect against the HPV types that is causing the cervical cancer in women.
So only the Gardasil 4,
yes,
that can fight what you are fighting?
Yes, what we are fighting.
Oh, okay. But there are others there?
Yes.
What are those?
We have the Gardasil 9 as well. We have the Cyrillic vaccine too.
Vaccines, what do you call it? The HPVs, so the 4
yes,
can kill
so HPVs, we have different types. There are a number of HPVs coming together to cause this. So we have the number, and most of the time the HPV 18, 16, 45, they normally cause the cervical cancer. So due to that, we are using the Gardasil 4, and the Gardasil 4 has the 16, the 18, and the 45, which causes the cervical cancer.
Oh, okay. So Thelma, who should get the HPV vaccine, and at what age? She made mention of 9 to 14. They are, so apart from that, anyone above 14 cannot get it?
For the campaign, it's for 9 to 14 years. This HPV vaccine has been in existence for some time now. So if you are above 14 years and then you want to get the vaccine, just visit a health facility, communicate your request, and then you'll be attended to. But for this campaign, it is for 9 to 14 years.
Is it recommended for both boys and girls?
It's for both boys and girls, but then for the sake of the campaign, we are targeting the girls at the moment.
Why are you targeting the girls?
Because the girls are most at risk of getting cervical cancer. We know for boys you do not have cervix, It's only the girls who have cervix, and we normally get cervical cancer, and they are at a bigger risk of getting cervical cancer than the males. So that is why they are the focus for now. The emphasis is for now. Yes.
But the HPV is common.
Yes.
It's very common.
Yes.
And I'm asking this question because it seems you said your focus is on girls. Boys get, and through that they get the penile cancer.
Can I add up to whatever she's saying? Okay, so in other developed countries, the vaccination is for both boys and girls. In Ghana, because of cost effectiveness, okay, and you also know that the vaccine has been in place for more than 10 years and it's very expensive. So just a certain group of Ghanaians that were able to afford the vaccine. It has been there for more than 10 years.
So it's expensive.
It's like very expensive. So by the grace of God now, we are making it free.
Oh.
Yes, so for this September, the vaccine and beyond, the vaccine is going to be free. So even for those who are not falling within the age range of 9 to 40, maybe they are age 7, who have not gotten to the age bracket yet, can do it the years after when they get to that age.
Will it also be free?
Yes, it is. It has now been rolled as part of the national immunization program.
Oh,
that is the
Part
good
of
news.
API.
You get it, and for us, because it's now free, and we want to get a lot of girls to get vaccinated. There's something called herd immunity. We believe that once most of these young girls are vaccinated against the HPV infection, in a way, the boys are also protected. Because as we said earlier, it is transmitted from person to person. So if we have a bigger or a larger number of girls being vaccinated against it, the boys are also in a way protected.
But what if the boys or some of the boys have been, transmitted already?
So right now, our target is for those who have not been transmitted already.
How would you?
What has happened
would
has
you
happened.
screen
We are
them?
trying to protect the ones that are.
Will you screen them?
Now the target is with the females, the female adolescents. That is our target. Not that the boys cannot take it, but our focus now is with the females. So later the boys will come in.
So
later,
for now, the boys, when the boys come, you will not.
No, please, they are not part.
They are not part for
Then
now.
a time will come. All the boys, if you are going for a girl, you have to make. Do you give them some card?
Yes, we'll give them a card.
So the girls will carry the.
They'll get the notation
They
card.
have to carry the card in their bags.
Yes.
So when you get a girl and you want to,
you don't have any bags.
That should serve
You should
as
show your
passport.
card that
Show
you
your card
have been
before
vaccinated against the HPV.
Yeah, you show for us to see that you are fully protected, before we can engage any activity with you.
Very important.
So what happens if those who are supposed to get the vaccine within the age brackets don't get vaccinated for HPV? What happens?
As Vic was saying, that there's something called the herd immunity. So if a category of people are not able to get the vaccine, after the September program, the vaccine still continues, so they can still come in for the vaccination. All is not lost. They should still come one step ahead, so they can come for it. Also, when majority gets the vaccine, there is herd immunity, so it covers the rest of the population. So in a way, the others will also be protected against the HPV vaccine from spreading more to others.
So does that mean that if you are vaccinated, for example, you've not been engaged in any sexual activity and you've been vaccinated, then you, after vaccination, you engage in sexual activity, but the boy that you engage with has it, can it be transmitted to you?
No, it cannot be transmitted because you already have the protection.
Okay.
So that will protect you against
But the guy will still have it.
Yes.
When it comes to vaccines, it's very, very necessary because we all have to be very serious about it. So, what is the vaccination schedule, Vic? How many doses are needed, and over what time period?
Okay, so for now, the Gardasil 4 is just one dose.
Over what period?
It's
For
just
life.
for life.
For life. So just one shot
Just
for
one
life.
shot.
It's not like a year, but recently crowdfunding.
The COVID one that you have doses
Booster and
schedule,
stuff.
we have schedule.
This one is just a
this
shot.
one is just a shot.
Yeah.
And it is free.
And there's no booster. Yes, and it is free.
You made mention of the vaccine. This vaccine particularly has been in Ghana for over how many years?
10.
Over 10 years.
More than 10
Over
years.
10 years.
Yes.
So a lot of people have been getting.
A few people get access to it because it's expensive.
Yes.
So you would need to have the funds to afford it to be able to get it.
So for 10 years, there hasn't been any reduction in terms of percentage of people who contract this disease.
No, it was expensive, and when they started, it was a group of people who did it. So it was a pilot program that was done. So not all the district, Cape Coast, we did some. Not all the district had the opportunity to take the vaccine. And secondly, it wasn't all the hospitals that are being taken or giving the shot. Unless you travel to Accra, Takrady, before you can get the shot of the vaccine. And thirdly, it's very expensive. It's very
So
expensive.
expensive, how much?
Oh, it's the Gardasil 4 now is the one shot is 3,200.
Can you imagine?
3,200 for a vaccine.
Yes, for a shot.
And now it is free.
It is
Yes,
not.
and now it is free.
Oh, wow. Very expensive indeed.
Yeah, very expensive.
3,000.
Yes.
So that is why a lot of people are not taking the vaccines. Not that they don't have the knowledge about, they have, but because it was expensive, they were not going in for the vaccine. Yes.
So is cervical cancer managed or treated?
Cervical
It can
cancer
be treated. Both. It can be treated when seen early. It can be treated.
preventable. Let me use that
Yes,
word.
preventable.
It is preventable.
Yeah.
So when you get screened early and we pick up those precancerous lesions, there are a lot of things that can be done to prevent it. But once we don't pick it up early and you start seeing the signs and symptoms of cervical cancer,
Oh, and you can't do anything
treatment
about
is
it.
very expensive and mostly unsuccessful.
Expensive
Yes.
and mostly
mostly
unsuccessful. Which you pay enough money,
Enough
but
money.
you may not survive.
Yes.
That is why we want to come together to fight against cervical cancer from coming. So we want to prevent it from occurring.
So how many people have you targeted this month to vaccinate?
All girls.
All
within
the
Cape
adolescent
Coast
girls from 9 to
metropolis,
14.
9 to 14.
Yes.
So from this time around going, from this time going, is going to be free. No more 3,000.
Yes,
payment.
please.
No.
Just
No,
like
not
going
at
for
all.
weighing.
Just like now, it's part of the expanded program for immunization.
Immunization.
So it's part of it. So now it's like going for normal weighing in vaccination that we've been doing, our daily vaccinations that we do. It's now part. So when you come and you want to do the test and you fall within the age range, we just give the shot.
Questions and stuff. So let me focus more on the campaign. Where are you going to start? We know it is this month. Where are you going to go to various secondary schools?
Yes.
Or you are going to be stationed somewhere for people to come?
For September, we'll start with schools. We'll be going to schools. We'll go to churches. We'll go to other group of people which have the age range so that we can get our target population, the people that we want. So it wouldn't be at one place that we will go for us to capture all the adolescents who are involved or the age.
So this age bracket is mostly at the secondary schools, right?
Yes, and the primary
or
GHS.
Even at
yes.
churches, wherever,
Churches.
community
Churches, Sunday
centers,
school.
wherever we find.
Oh yeah, yeah. Was it white? Oh yeah, yeah.
Oh yes,
It's injection. So
There will be an injection. What is it on your shoulder, your buttocks, your thigh? Where?
it's your left upper arm.
Okay, that's fine. I thought somewhere. Anyway, and so how effective is the HPV vaccine preventing this? What do you call it? HPV related diseases and cancer. How effective is it, Thelma?
It's very, very, very effective. 100% effective. As long as you take it when you've not engaged in any sexual intercourse, it is 100% effective.
Okay, so you've brought some cross there.
Yes.
If you have not engaged,
Yes,
it's very effective.
very, very effective.
If you have engaged, it will be effective,
yeah,
but
the
not very.
efficacy is
Not very.
low.
But it will be effective.
Yes, but not very, very effective compared to an
Someone
individual who
has
hasn't, had any sexual encounter.
But do you have any success stories that will testify what you're saying?
In
That
relation,
they are very effective.
effective. We have people who have taken the vaccine by themselves, and they are fine. They've not developed cervical cancer. Yes.
Okay, all right. This is Cafdil Healthcare on Cafdil TV. We are discussing HPV vaccination campaign, which is going to be enrolled the whole of this month. And so it's imperative that you get the understanding before. We know some of the parents are, even some of you are afraid of getting vaccine, but I hope per what we have discussed, all the fears are coming down. So you've already said, let me come to you, Vic. You've already said that it's one shot for a lifetime, but does that mean that with your whole lifetime there wouldn't be any booster, any check, nothing?
Okay, as I said earlier, once you have it, you get the shot. It is lifelong protection. But to be on a safer side, you still need to be screened from time to time.
So when you're screened and you have it, what do you do?
So when you screen and we pick up any precancerous lesions, we have other management that prevents it from turning into cancer. Yes. That is why we were saying that cervical cancer is preventable. And for you to prevent it, it is basically through the vaccination and the screening. That is the only way.
So is what you talk about, is it free? Is it also free?
Yes, the screening. No, the screening is not free.
Is it expensive?
No, it is not expensive. We have different types, so whichever one you're able to afford, then you do it.
What are those types?
Okay, so we have the HPV DNA testing, we have the visual inspection with aseptic fluid, then we have the pap smear.
Pap smear, that's what we've been hearing.
Yeah.
I think that is the most common among them. Oh, okay. Pap smearing. I love the name pap smear. Well, I remember some time ago we met, and I think it was Ifua herself. She kept on saying pap smears. Oh, okay. So, is it safe? Because a lot of people are afraid.
Yes, the vaccine. Yes.
Is it safe?
The vaccines are safe. The vaccines are safe when you take it. Sometimes you have other side effects, which is very mild. With compared to HPV vaccine, it's very mild. It's very safe. So they shouldn't be afraid. Everyone is encouraged to come and take the vaccines, because when you take it, it protects you against the HPV virus. So it's very safe for you to take. As my sister was saying, that it is 100% efficacy when you are not exposed to sexual intercourse. Yes. So if you know you're a virgin, let me put it this way, you are 100% protected from the HPV virus. Yes, so it's very safe for you.
But if you are not virgin, how many percent protection?
The efficacy is below 100%, but well, we can get 90 out of it.
A big deal. So you made mention of possible side effects which are mild. What are those side effects?
Okay.
Possible ones?
Like when you take the vaccines, you can get a mild a fever or headache. There can be nausea, dizziness, and these are very mild, and it's very rare in happening. It's when you take the vaccine. So these are some of the side effects that one can encounter. Also, it can also happen. That is why when you are sick or you have some signs and symptoms of a condition, we advise that you wait when you are well, that you take the vaccines. Yes.
So when it happens, do you need to take medicine in the house, or you can leave it and it will just...
No. When it happens like that, you don't take any medicine. You leave it. It will fight by itself, so it will go. Yeah. Your immunity will fight against it.
What about if your immunity are very low?
So in instances where you are not seeing that there's been any changes with the side effect that you just report to the hospital.
Anyway, let's take us through the adverse events, of the HPV, the possible ones.
The side effects of the vaccination.
The adverse event of the HPV.
So, as she said, there could be mild pain, headache, drowsiness. These are all side effects of most of the vaccines that you take. And it's even possible you not feel anything at all.
Does it happen immediately taking it, or it will take some time?
It can happen immediately or just some few minutes after you've taken the vaccine. But the body fights itself and it goes. It's just a response, your immune system's response to the vaccine.
And it's individual difference. We have each and every one and their immunity level. Yes. So it depends on the individual who is taking the vaccine.
Okay.
Exactly. The immunity of that person.
Okay.
Yes. So some might start immediately, some might start later, which wouldn't be more than 24 hours.
So on the menstrual cycle?
No, please. The vaccine doesn't have effect on the menstrual cycle.
The only thing we are saying that if you are within that age bracket and you are pregnant, you can't take
when
the
you are
vaccine.
pregnant, you can't take the vaccine.
If you are very sick, you have to wait so you are well before
very sick. How do you define the very?
If you are sick, malaria, you're already showing signs and symptoms of other disease conditions.
If you are sick, if you have a temperature of more than 38 or more than 37.5, you realize that your temperature is already high. You are feeling feverish already. So someone like that, you need to wait when the temperature normalizes. Then you come in for the.
So this campaign, this exercise is going to continue.
Yes, please.
It's going to be with us.
Yes.
So in about a year, and you are, coming up with this. Is that he has not seen it before? It happened only after taking the vaccine.
So how did the person
know?
How did the person know that it's because of the vaccine?
It's because of the vaccine.
No,
because
how did he know?
Because before the vaccine, he had never experienced that.
There have been researches that have even shown that they studied people over 15 years after taking the vaccine, and there were any sign of showing that the vaccine is even causing anything to them, or it has even weared off or something. It's even causing anything to them, or it has even weared off or something. It's working perfectly.
So if something will happen to you, it has to be within some few minutes.
Yes.
So after a day.
That's what you said, after 24
hours.
And there are instances you will not even feel anything
at all.
So we have to just have this positive mind when it comes to vaccine.
Yes, when it comes
No
to
one
vaccine.
will actually prepare anything to harm us,
Not
but
at
it is
all.
always for our good. Do you know that some developed countries have actually eliminated it?
Yes.
HPV.
Yes, with their vaccine.
Yes, with the vaccine. So that is the goal.
Which country?
You have to check on a lot of developed countries. I don't want to say
US.
A lot of developed countries, yeah.
But
So it is
that
possible.
And
developed
it's been
country
part
that
of them for a long
Long
the
time.
time.
developed country that you've made mention of, that is where the headquarters of this HPV, World HPV, whatever, is located.
Yes.
Yes.
So their focus is to eliminate it everywhere. So if they have been able to implement it and successfully eliminate it, they are not supposed to be selfish. They're supposed to
9 to 14 who has not
everywhere.
engaged in any sexual
Yes.
after vaccination, that person is fully protected. Don't you think that it will encourage early sexual activity among the teens?
Not at all.
Because I'm going to have sex.
So,
This thing wouldn't happen to me.
listen, you have been vaccinated against HPV. Have you been vaccinated against HIV?
We are
Have
talking
you-
about HPV.
Yes, you are, so
Yeah.
if you are scared of getting cervical cancer and you've been vaccinated against it, what about the other
Other
sexually
STIs.
transmitted
You have
diseases?
other sexually transmitted.
Someone said that he's afraid of diarrhea than HIV because HIV will take you 10 years. Diarrhea can take you 5 hours.
When you get HIV, you get diarrhea. Worst form of diarrhea. So the person doesn't know what he or
What
she is
he's
saying.
saying.
That is it. One of the common signs and symptoms of HIV
Is diarrhea.
Bad one.
But you know that people are not afraid of HIV. You see, they may have not heard much about HPV,
I
but
think,
HIV is common,
I
so
think-
they are not afraid.
yes, people are not afraid of the HIV now because of the sensitization which is going on. So a lot of people are now exposed to the educations on going on and other things. So they are well abreast with HIV education, the preventive measures and the management. But when it comes to HPV like that, majority don't know much about the HPV and they don't know the incidence rate of HPV, which is gradually increasing in Ghana here. So that is why they are not much afraid of that. But HPV is likewise also very a serious STI disease, which is also killing a lot of people, especially women with the cervical cancer.
Anyway. Then
So as
let-
you are
let your
saying,
education go on.
so as you are saying, not that taking the vaccine will prevent them from, will encourage them to have sex, but the vaccine only prevent them from the HPV, but the other sexual
And
STIs
even-
are still there, which you can get it through sexual intercourse.
The other ones
So-
are the ones that they are not afraid.
That's we have other
They've had
types.
all syphilis and this, but still they do have it.
Even with the HPV vaccination, we are saying that this Gardasil 4 is protecting against the
Only
strains
4.
16 and 18.
18
And we've told you that we have over 100 strains
strains of
of
HPV.
HPV.
But which of them is common?
16 and
16
18.
and 16
and
That is
18.
It has, I think, 70% cause of cervical cancer in Ghana.
Ghana.
But we have other
And
strains.
that's common in Ghana is the one
So
that
what
you've gotten
if,
it
what if
vaccines.
you find yourself getting the ones that are not? So it is not. So you protect yourself. You avoid having multiple sexual partners.
Partners.
If possible, abstain from sex. You vaccinate, and you also get screened. That is the only way to go. Abstain from sex. Avoid multiple sexual partners.
Yes.
Get vaccinated and get screened.
And then
Yes,
me
screen.
Yes, however. And you are coming to tell them abstain from what?
Sex.
So Australia is gradually
They are on their way
eradicating.
eradicating.
They've
Yeah.
reached 90%.
Yeah.
And
Australia.
we are which percentage?
We are still
We
on
have
it.
not.
We are still on
We are
it.
still on it. That's
Very,
why we
very
are all
low. Very,
That's a
very
reason,
low.
I see.
Yes.
So
About
some
to
most
start.
of the parents are afraid. They are much afraid about
Yeah.
that. So let me ask, how can parents, address their fears or doubts about vaccinating their children?
Okay, what we will say is that no parent should be afraid of the vaccines. Already, they've been going for child welfare clinic. Let me put it way in. That's they vaccinate their children. So this shouldn't be cause a fear in them. Also, when they have any concern, they should reach out to all health workers to the clinic. When they come, we will explain further to them to understand how the vaccine is working and how it is going to protect their children. You and I know that the adolescents, they are the backbone of us in the country. When they are not growing well, our country will not also be in good shape. So we are trying to protect them. They are our future. So we are protecting them. So we are encouraging the parents to bring their children for their vaccination this September to protect them against the HPV virus.
Would you want to add?
She said it.
She said, oh, hey, if a customer
we are all around. They can reach out to us if they have any concerns. And
when they come to CCTH, Cape Coast Teaching Intervention,
Yes.
Okay. So, where and how can people get the HPV vaccine in their community or various communities?
Okay, when we start with the vaccination, it will be done in every district. So we have the clinics there. When you get to any public health department, the child welfare clinic, it is being done. That is the mainstream for the part of the EPI, the normal vaccinations that we do. We'll be moving from schools to schools, as we already said, going to churches, and that one will be done with team. Nurses will be going around.
The whole of this month?
Yes, please. Nurses will be going around.
You'll be going to, okay, not boys' schools, but girls' schools and mixed schools?
Mixed schools, yes,
okay.
please.
Okay.
Yes, please.
So every mixed school and girls' school, or single-sex school in Central Region,
yes.
you are going to cover
please.
all of them before you come to various communities and churches.
Even in Ghana.
The whole Ghana.
It's a nationwide campaign program.
Who is sponsoring?
Ghana Health
Service is now sponsoring. Yes.
Then, Kakra Umbia.
For the
no, it's free.
For all of us.
But
it's free.
It's free.
It's free. We are being paid monthly. We are okay with
We are fine.
Look at the I say
It's free.
It's free.
Oh, okay. So we know the girls are very stubborn. They are very stubborn. So what will you? Each is going to. Our time is up. So you're going to. I'll give you 2 minutes to speak to the girls.
Okay.
Because you've gone through that stage up to now. Yeah. So I'll give you 2 minutes to speak to the girls directly.
To the girls out there, I want you to know that cervical cancer is real. It is a killer and it is preventable. We can break that silence by getting vaccinated and getting screened. Somewhere in the world, every 2 minutes, a woman dies of cervical cancer. And this woman could be your mother, could be your sister, could be your loved one. So help us champion this agenda of eliminating cervical cancer by getting screened. So please, mothers, if your children fall within this age range, try and encourage them to get screened. And also, if you've passed this age and you are in your 30s, or even if you have any other conditions. And I also want to say that women living with HIV have 6-fold higher risk of getting cervical cancer. And they also need to be screened starting from the age of 25. So if you're a girl and you find yourself in all these categories, or even if you don't even find yourself, I entreat that this September, make it a point to get vaccinated against HPV.
All right.
Thank you.
But before I move on to Thelma and Ifwa, let me ask you this question. This age bracket, 9 to 14, somebody virgin at age 25, still virgin, can that person be vaccinated?
Yes. So actually, research has shown that even some virgins have, and they said they've not had any sexual intercourse or whatever it is, they have
HPV.
Yes, they have HPV.
How?
Yes, so when I started, if you paid attention, mostly our attention is on the sexual intercourse.
But not skin to skin.
Yes, not skin to skin. The HPV, they are found on the skin. So
it's something that you cannot
some people
use your
actually get involved in sexual activities without sexual intercourse. They do other stuffs. Someone can even tell you that after all, they are a girl to girl, boy to boy, they are doing things. So where from the anal cancers and all that.
Those who do anal sex.
Yes. So HPV is actually found on the skin. It is found on the skin. So skin to skin contact and the sexual intercourse. Let us not focus on only the sexual intercourse.
And if someone has it and we are in the same car, my body kakana.
So it's skin to skin. Yes, so that is why we are.
And
the funny thing is, you could just get it and it will be with you for more than 10 to 20 years. And mostly women between the ages of 40 to 50, that is where they are diagnosed of cervical cancer, if you have realized. So these people actually had it way back. Yeah.
All right, Thelma, speak to your girls.
Okay. What I'll say is that they should know that their body is the only property that belongs to them personally. And then we have to take good care of ourselves. And abstinence is the key for my adolescents. Abstinence is the key. And it's not something that is impossible. It is very, very possible. And as we are vaccinating this month, we are praying and hoping that every parent will make their girls available for them to take the vaccination. If they are listening, they should also speak to their parents so that they'll get the chance to get vaccinated, so that they can prevent cervical cancer. Because, as we said earlier, it's preventable, but it's also very deadly.
Eva.
Okay. I would tell them that they should come together and let's champion all this together, because we hold the future as adolescents. And as we are championing this together, they should go ahead, speak to their peers about the HPV vaccine, which helps to prevent the HPV virus. And this is going to be a long way to help the adolescent girls in Ghana. Thank you.
All right. Thank you too. Thanks for your time. We appreciate your time. But you will still explain what you mentioned. Thank you for watching. And let me remind you, the whole of this month, this campaign, this vaccination is going to be enrolled. Thanks for watching. Thanks to all the crew. My name is Kojo Arthur. Same time next week. Good night.